Buddy, we're just going to let the crowd arrive through the Zoom doors here. Get comfortable. We'll get going in a few seconds here. Morning. As folks arrive, just want to remind you we have turned on captioning, so feel free to make use of that if you would like. All right, I think I will get going with some preliminaries here. Welcome and good morning. My name is Joe Hannell. I am Communications Director at the Colorado Health Institute. And thanks for joining us this morning on our webinar, our monthly webinar. This month's topic is Building Bridges for Better Health. We're going to be talking all about community clinical linkages. We have, as I'd said earlier, if you weren't here, captioning is turned on, so feel free to make use of that. If you'd like to ask questions, we will have a good part of our webinar for a panel discussion. You can drop your questions in the chat. You can put them in the Q&A. You can use the raise hand function on Zoom, and we can unmute you, and you can ask those questions. Make use of any of those ideas. So, for starters, just want to remind you of the Colorado Health Institute. If you're not familiar with the Colorado Health Institute, then then it means I'm not doing a great job as Communications Director of the Colorado Health Institute. But we are a nonprofit public health institute. Our mission is strengthening communities and systems with trusted analysis and collaborative solutions to improve health. A lot of words, but there's things that we do, specific things. We answer critical questions in the policy world. It's a complex world. We make sense of it. And we work closely with others, supporting them to find solutions that matter. And that's a lot of what this webinar is today, building bridges to better health through linking different groups that aren't used to talking to each other. So we will start out with a presentation from my two colleagues at Colorado Health Institute, Kirsty Klaverkamp and Lauren Bell. And then we're going to move into a panel discussion with a couple of guests from the State Public Health Department. Without further ado, I'd like to turn it over to my colleague, Kirsty Klaverkamp.
Thanks, Joe. Good morning, everyone. My name is Kirsty Klaverkamp, and I'm a director at the Colorado Health Institute. I've been on the team for about 4.5 years, but I've been working in Colorado for over a decade, supporting partnerships and programs, advancing priorities related to social determinants of health, chronic disease prevention and management, and climate and health priorities.
Welcome, everyone. My name is Lauren Bell, and I'm a program manager here at the Colorado Health Institute, where I manage the operations and implementation of the Metro Denver Community Clinical Linkages for chronic disease prevention and management, which we'll be talking about today. Prior to this work, I spent about a decade implementing and managing aging programs and services in the Denver metro area, primarily at our local area agency on aging. I have earlier experience serving as a social worker and direct care provider in skilled nursing facilities and group homes that serve older adults and people with disabilities.
Thanks, Lauren. I would now like to introduce our guest speakers for today. We're so excited they're joining us and are grateful for their continued partnership. Elizabeth Alden is the Community and Clinical Linkages Coordinator at the Colorado Department of Public Health and Environment. Shelby Rymink is the Quality Initiatives Coordinator at the Colorado Department of Public Health and Environment. We look forward to speaking with them later this morning on the panel, where we'll learn a little bit more about their work and their vision for Colorado. We are grateful that you are all joining us here this morning. Today, we are going to acknowledge the fact that there have been many recent federal actions in the current administration that are quickly shifting our public health and social services infrastructure in a variety of ways. And in these changing and in these challenging times are some that if we can intentionally lean in, if we can think thoughtfully about working together collaboratively in ways such as through community clinical linkages, we can continue to bridge the gaps and ensure that we can continue providing the care and services that we know individuals and families across our state benefit from. And that the Metro Denver Community Clinical Linkages Network shows us that we can continue advancing health by working together. For our audience members joining us today, we're curious what brought you here or what keeps inspiring you to show up to do the good work during these times. If you'd like to share your name and thought in the chat, we'd love to see who's joining us today and what your ideas are. All right, we want to acknowledge that there have been many federal actions that have been occurring since the current administration took office. We don't have time to do a full analysis of all the impending changes, but we did feel like it was noteworthy to share a few points of data that we are aware of to ground us in our conversation for today. We're aware that Colorado has lost about $250 million already in public health and behavioral health resources as a result of decisions that have come out of the Department of Government efficiency in pulling back pandemic relief funds. While we don't yet know the full ramifications of these changes, it definitely represents a significant loss and something of which many of our leaders and partners are still figuring out how to move forward. We also know that on top of this, there are proposed cuts to Medicaid and the Supplemental Nutrition Assistance Program, otherwise known as SNAP. If approved, these cuts would result in about $1.1 trillion in losses for these programs over 10 years nationally. And we know that many individuals and families use these programs for critical access to get healthcare, but also food and nutrition. Even more so, we are aware that there are efforts to cut about $700 million nationwide in rent subsidies and also homelessness response grants. We also know that it's individuals and families and older adults who benefit on these resources. I bring us forward even more to share that we're also aware that there could be cuts in 2026 that reduce funding for the Head Start program. This is a program that serves about 500,000 low-income children and families across the country. And if you're not as familiar with this program, it is a preschool program, but as a part of this program, children also get health screenings and healthy meals throughout the day. This program serves to set kids up for success who might otherwise fall behind before kindergarten. I recognize that these are a lot of numbers. There are a lot of comments about what could happen and what is happening. But the point here is that we've known for years that our health and our overall well-being is impacted by much greater factors than any one clinic or hospital can take care of alone. It's access to healthy food, it's access to safe and secure housing, quality education, mental and behavioral health supports that really make a difference in our health. And so while we're still figuring out what all these changes mean and how we move forward, we do know that these changes will significantly impact many of our communities across Colorado and the nation. There's a lot to keep up on, and we're doing our best. We know you are too. We wanted to share one resource that you might find useful to try and manage all of the news and updates related to executive orders that have happened and perhaps more to come. It's a policy resource tracker, provided by an organization called Health Begins. CHI has no role in putting this policy tracker together, but they just released it, and we'll share that resource in the chat if you find it helpful. I'd also encourage any of you who have a resource that you'd like to share with others on the call to go ahead and share that in the chat as well. Lastly, before I pass it over to my colleague Lauren, I'd be remiss in saying that a lot of this news can weigh heavy on a lot of us. And so if you have found a practice to kind of care for yourself during these times, because we know that's important as well, feel free to share that practice that you've been able to figure out and recommend to others.
Thank you, Kirsty. And understandably, these resource shifts can create uncertainty and scarcity mindsets that might prevent us from leaning into other partners and organizations as we look to figure out solutions moving forward. Through intention, though, these situations can also prompt innovation and collaboration in meaningful ways. We saw this during the COVID-19 pandemic, where there were significant changes in the types of partnerships that the public health system leveraged to respond and provide services during a great time of need. A few examples of these things that we saw were more partnerships with community organizations, more creative ways to disseminate health information and care through recreation and faith centers or other places in the community to meet people where they were. And we learned how to do better with the resources we had by working together. Community clinical linkages that we'll talk about today are established partnerships across healthcare, community, and public health organizations. These partners create connections between healthcare and non-healthcare settings to advance a shared goal together. Partners might include community-based organizations, volunteer organizations, barbershops, local jails, or pharmacies. And they may also include clinical organizations like federally qualified healthcare centers, rural clinics, or hospitals. Together, these organizations create ways to make it easier for people to get connected to programs and services that support their overall health and well-being outside of a clinic or a hospital setting.
Thanks, Lauren. Now let's explore, what do these community clinical linkages actually mean for people in our communities, the patients and clients we're serving, but also the staff at our community-based organizations and the providers and care coordinators at our clinics. Let's go through a story to see what this looks like for the people. Meet Malia. Malia is a 30-year-old mother of 2 children. 2 months after she prematurely delivered her baby, Malia experienced numbness in her feet and was urinating frequently. She visited her primary care doctor to figure out what was happening. Dr. Victoria Costa ordered some blood tests to try and figure out how she might be able to help. At Malia's follow-up appointment, Dr. Costa explained Malia's lab results. They indicated that Malia had prediabetes and was at risk for developing type 2 diabetes. Malia asked questions and Dr. Costa answered them. And Dr. Costa was also able to tell her about a program at the National Diabetes Prevention Program. She felt like it could potentially help Malia a lot if she was interested in pursuing it. Malia was. And with that, and with her permission, Dr. Costa's care team sent a referral for Malia to Eric at the local community center. Eric was the health program coach that offered the National Diabetes Prevention Program. Eric called Malia the next day to talk more about the program, its goals, activities, and schedule. Malia and Eric had a conversation about it, and Malia was interested in joining. Eric signed Malia up to join the program the following month. Fast forward, and Malia completed the program. She learned a lot along the way, and ultimately she was able to help the progression of her prediabetes to diabetes. This was a huge success for her. She felt better, mind, body, and spirit. And even more so, she felt supported because she was connected by both of her providers. And Eric and Dr. Costa also felt supported because they were connected and could do a better job for Malia together.
Thanks to the Cancer, Cardiovascular, and Pulmonary Disease Grant Program through the Colorado Department of Public Health and Environment, CHI has had the privilege to launch a community clinical linkages network to put this work into action and make these impacts real for individuals, families, and providers in the Denver region. The Metro Denver Community Clinical Linkages for Chronic Disease Prevention and Management is just one model of how community clinical linkages can be built with and for local communities. CHI convenes the network as part of the Metro Denver Partnership for Health's efforts to advance health through regional collaboration and action. And if you're interested to learn more about this partnership and what this might look like, you can view the link in the chat. The current network partners include 4 healthcare centers, 1 public health agency, and 3 community organizations. Their shared vision is to connect more people to evidence-based programs that help prevent and manage chronic disease, such as the National Diabetes Prevention Program, Diabetes Self-Management and Education Support, and self-measured blood pressure monitoring programs. Partners from these organizations meet on a regular basis to build trust with one another and strengthen relationships across their organizations, as well as learn about services and programming that they offer. CHI provides technical assistance to support them in designing agreed upon processes and workflows so that people can be referred from their clinic healthcare setting to the public health or community partners providing these evidence-based programs. Through these workflows and data sharing agreements, these organizations formalize their partnerships through shared commitments. Together, they are increasing people's access and connections to community-based programming that makes a significant impact to chronic disease outcomes, which is one of the network's long-term aims. These efforts would not be possible without this network of organizations working together across the metro area. Our partners routinely screen individuals for diabetes, heart disease, and related risk factors in healthcare settings. Our clinic partners include Clinica Family Health, Denver Health, Stride Community Health Center, and Uptown Community Health Center. Our partners providing these evidence-based chronic disease prevention and management programming include Adams County Health Department, YMCA Metro Denver, Foila for Health, and WellPower. Each community partner provides unique value with the evidence-based programming they offer, whether it's their program in Spanish, tailoring their programs to best serve people with mental or behavioral health diagnoses, or offering in-person and virtual options to meet people's work, family, or transportation needs. Each program and service is unique. One clinic cannot serve all individuals and families, just as one community partner cannot provide all the programming to meet everyone's needs and goals. That's the power of this network coming together. These organizations are more aware of the programs and services that each of them provide, and they know about where and how they can connect people between their clinical care settings to community settings so that they can participate in programming like the Diabetes Prevention Program. These programs make tangible differences in people's health and well-being.
So we've heard about what community clinical linkages are. We've heard about what they do and who they impact, but really, why does this work matter? It matters because we know 50% of deaths in Colorado are from chronic disease. That's significant. But we also know that it's different communities across Colorado that are experiencing these realities differently. Hispanic and Latino people are more than 2 times as likely, and Black individuals are nearly 3 times as likely to have diabetes compared to white people. We also know that Black people experience the highest rates of blood pressure and heart disease, followed by white, American Indian, and Native Alaskan, Hispanic and Latino, and Asian American and Pacific Islander people. And yet we also know that households with lower incomes are more likely to have a chronic disease than households with higher incomes. These differences in health statuses are important because they point to greater inequities that are happening across Colorado that are rooted in a variety of things. One of these inequities is rooted in access to care or lack thereof. Fortunately, there's hope because we do have tools. We have tools such as these evidence-based programs that we know are backed by research and evaluation that are proven to make a difference in health outcomes for many people across different communities. Health outcomes related to these chronic diseases that we've been talking about today, like diabetes and heart disease. These evidence-based programs may not be able to address all the health inequities that we talk about and work to address in public health, but they do make an impact like we've shared. The National Diabetes Prevention Program has been demonstrated to lower the chance of developing type 2 diabetes by 58% compared to individuals who do not complete the program. This is also significant because we know diabetes over time can lead to a variety of other health conditions, such as loss of vision, stroke, kidney failure, and also heart disease. This means that investing in these partnerships, like community clinical linkages, are worth it to better connect people and improve their access to these programs that we know can help. But I think others could say it better than myself. A recent program participant shared with us what this program did for them. It's an excellent program, they said, that has helped me a lot in learning how to eat healthy and take care of my health. It makes me feel important, and I have achieved great results by attending the sessions. We thank them for that little piece of their story, and I also want to acknowledge our partner, Jessica Giffen at the YMCA Metro Denver, because she's also shared after seeing the differences in these programs and for people that ultimately the work we are doing together by cultivating strong referral networks and building meaningful relationships between organizations is the foundation for clinical community networks. And we couldn't agree more. We may not fully know what the future holds for our public health and social service systems and resources, but can make a greater impact than any one organization could do alone. And with that, I have the opportunity now to turn it over to our guest speakers, where I will be joining them on today's panel discussion.
All right, thanks so much. We're time now for our panel discussion. After we've had that grounding, I'm joined by my colleague Christy, who magically teleported over from where she was giving that presentation. And then also a couple of guests from the Colorado Department of Public Health and Environment. Elizabeth Alden is the community clinical linkages coordinator at CDPHE. She's been there for a year and a half in that role. And she oversees the Regional Health Connector program, which CHI helped incubate way back when it started almost a decade ago, I think. She also co-leads a learning collaborative group focused on developing and strengthening community clinical linkages. And she comes from a nutrition background. We were just talking about cooking classes that she taught. She's worked here in the US and abroad, teaching cooking and nutrition. Most recently around the Metro Denver area, she managed relationships with the neighborhood groups that hosted those classes. Mm-hmm. And then Shelby Reimink she's been with CDPHE for 2.5 years, currently in the role of Quality Initiatives Coordinator on the cardiovascular health team. So in that role, Shelby works to advance cardiovascular health outcomes through clinic quality improvement efforts and strengthening bidirectional referrals, a lot of what we were just talking about in that presentation, between clinics and community partners for social supports and evidence-based lifestyle changes. And previously, she worked for an electronic health records company supporting healthcare staff in using those records. So we have half an hour here for this discussion. I encourage you to join it. you bring in your questions through the Q&A, through the chat. Even if you'd like to talk to us, you can raise your hand and we can unmute you. You can listen through my computer here. But I have a few questions to start off with. First of all, for Elizabeth. We've just heard a lot about community clinical linkages, but where do they fit in the overall big picture of the state's public health strategy?
Yeah, thank you for that question. So we know community clinical linkages are in and of themselves an evidence-based intervention. They support prevention and management of a number of diseases, chronic diseases in particular. So within the Colorado Chronic Disease State Plan, community clinical linkages and expanded team-based care, relatedly, are key strategies for improving equitable access, right? We know that it supports equity and access to healthcare and addressing social determinants of health that impact chronic disease prevention and management. They're also critical to reducing silos. And we know that's super important for increasing our efficiency across the state, right? So it helps support alignment between various programs and improve that access. And we know that's super important. A lot of factors that affect our health happen outside of the clinic setting. So by strengthening these relationships with community settings, we can help folks to be able to reach their best health that they can. You might not see community clinical linkages explicitly spelled out, right, in any of our goals and any of our projects, because they're really a mechanism or a model by which to achieve a bunch of other goals. So you won't see them as like community clinical linkages for health outcomes, but it's a way to get there. And so we've got them in a bunch of like grant applications. You see them in, different state plans and all of that. So really, really support all the work that we do across the state.
So thanks for that, Elizabeth. Next question for Kirsty. I prematurely passed you my microphone. Sorry. So that's the kind of the statewide strategy. How's that look on the ground? What does the collaboration look like for partners in the Metro Denver community clinical linkages that you work on so much through Metro Denver Partnership for Health?
Sure. Thanks for the question, Joe. I would be remiss in first acknowledging that none of the work we do or none of the collaboration is successful if we don't start with trust building. We found that this is a cornerstone, right, to any productive work across different organizations. And so the way we do that each year that we've been able to facilitate this network is annually we have a kickoff where we bring all of the organizations together who are in this network to meet in person. There's a lot of efforts you can do online, but there's something about being in person that you can't quite replicate when you're relationship building. And so that's how we begin. And we maintain those quarterly network meetings throughout the year as a chance for everyone to see each other, across the different organizations. And it's also a time where we are able to facilitate shared training and technical assistance. It's part of shared learning, another cornerstone of collaboration. But really, I think your question is like, what does it look like on the ground? And so monthly, I would say that's when the magic happens. That is when we meet with one clinical organization and one community organization each month. And that's when we really meet with them over a set period of time. They get to know each other's programs and services, their staff, leaders in each of their organizations, which is not just the executive directors or the chief medical officers, it's the health coaches, it's the care coordinators. They're all leaders in their own role with expertise, and they're all at the table because they need to be. And so it's during those monthly times where we really talk about how do we want to connect people across your organizations from a person-centered experience. And then we dig a little deeper, right? Where does the data come in, the referral forms, the technology, and really think about how to make that work. So that is kind of what it looks like day to day for us.
Right. I love it because I'm not a computer coder. Very few people are. And I think a lot of the impression is we need to get everybody on the same computer system. What you're saying is that this is person work. This is not techie work. This is FaceTime like we have here right now. That said, there's technology involved, right? um, it's not, we can't build a health equity app and turn it over to that, or say, Chat GPT, show me health equity, and then it's done. But there's still a role. So, Shelby, what is the role of technology that the state sees in supporting community clinical linkages?
Yeah, thanks, Joe. So we definitely see a lot of potential for technology to support community clinical linkages throughout the state. There's been a lot of movement within this space, especially with the Office of eHealth Innovation, with their statewide social health information exchange infrastructure, and their upcoming regional proof of concepts projects, which will kick off this summer. So the cardiovascular health team and the tobacco team at CDPHE has actually braided funding into the regional proof of concept projects, really to support the expansion and reach of these regional hub networks by providing financial and implementation support to providers and staff at organizations within these networks that really don't have the technology to support and allow them to participate fully in these regional referral networks. So through that work, we'll be supporting them also to develop and implement referral workflows for community-based lifestyle change programs, tobacco cessation treatments, as well as social services. So we believe that through these efforts, the statewide social health information exchange infrastructure will help in facilitating data sharing. It'll strengthen communication across clinical and community-based partners, and ultimately help support those community clinical linkages throughout the state.
All right. So moving on a little bit from technology, Kirsty, that's one challenge, one opportunity these days. What are some others outside of the tech realm?
Yes, as excited as we are about this work, we know it makes a difference. There are still challenges, I would say, that we talk about often and work through. The two primary challenges that come to my mind over and over again would be capacity and time. At the heart of this work is people, like Joe noted. And so when we're building these linkages or partnerships across the organizations, we have to recognize that more often than not, the role to build these linkages isn't within the primary job or position of the people we're working with, right? If you think about the healthcare provider, they have a lot of different activities to manage during a single patient visit that's maybe 15 or 20 minutes long. Or it is the care coordinator, patient navigator who has a lot of patients to support and connect them to a variety of resources. And of course, right, the community-based organization that are providing these programs, often, right, their funding is largely committed to direct services, not necessarily as flexible to do administrative work like building these linkages. So there can be a challenge there, I will say, in terms of capacity. I mentioned time, and I think that comes back to my first comment of the day is around trust building. That does not happen overnight. It takes time to build that trust in relationships and then figure out all of the technical details along the way. I think we are incredibly grateful that CDPHE understands that it takes time, and I just want to acknowledge that it can still be a challenge for others as well.
All right, thanks. Just a reminder, we still have about 20 minutes left in our program. I have a few more questions for y'all before we get to audience questions. Already seen one come in from Mary here, but so get those questions in, please. Meanwhile, though, question for either or both of our state guests here. What are some other opportunities that the state's looking at and exploring and continuing to build up community clinical linkages outside of the examples we've discussed here already?
Yeah. Yeah. Thank you for that question. I always get excited about the opportunities. So, like I mentioned, like Joe mentioned in my introduction, I oversee the Regional Health Connector program, and that program moved over to our division just this past July. So that's one really exciting opportunity that we have. This workforce works in community. They're part of their communities, and they do a lot of work in helping develop community clinical linkages and connect folks to resources at a systems level. And so, yeah, a key part of their work is developing those strategic partnerships, right? Identifying partners and connecting them together and helping support those community clinical linkages to develop. Um, they the move so the regional health connectors do a lot of good work in and of themselves, but their new connection to CDPHE is a really great opportunity as well to increase connections across state agencies, and promote alignment amongst all the programs. So like I said before, that alignment really helps with efficiency, and so we can really reach more people with what we got. um, so we're working to identify some state projects, where RHCs can engage and bring their knowledge of local partnerships and systems improvements. One of the projects that we're looking at, is for RHCs to support some healthcare systems that can benefit from their expertise and like really dig into that. And I'm going to pass it to Shelby to tell us a bit more about that piece of it.
Yeah, thanks, Elizabeth. So our cardiovascular health team plans to engage actually some of the regional health connectors to collaborate with some of our upcoming RAY partners that we're actually going to be engaging with for quality improvement efforts. But those regional health connectors will collaborate with our RAY partners basically to deepen the impact of community programs and help them in achieving their goals of kind of building health neighborhoods or like a network of community providers and resources within their regions, and also help them in strengthening care coordination. So I think we're really looking forward to these opportunities to kind of deepen the impact of RHCs and supporting community clinical linkages.
All right. Along those lines, Shelby, the work that Kirsty does here and a lot of other people in the Metro Denver effort, that's supported by CDPHE. What do you have going on around the state outside of Metro Denver in this realm?
Yeah, that's a great question. So, as I mentioned earlier, the cardiovascular health team and tobacco team at CDPHE braided funding into the Office of eHealth Innovations regional proof of concept projects, which will kick off this summer. So, as part of that work, as I said, it involves developing and implementing referral workflows for community based lifestyle change programs, for tobacco cessation treatments, as well as social services, all which will help to strengthen communication across clinical and community-based partners and support those linkages. Additionally, kind of through our cardiovascular health program, we have the opportunity to support a number of partners across the state. Partners which include pharmacies, clinics, and other community-based programming. And we really help to support them in developing and strengthening those community clinical linkages within the communities that they serve. Outside of that, we have the opportunity to connect with states that reside kind of within the western region of the country here, which is a unique opportunity. So we are able to participate in regional cardiovascular health peer-to-peer calls. So on these calls, they allow us the opportunity to connect with other cardiovascular health staff from states kind of neighboring in our region, where we can really connect and collaborate and engage and learn, share insights, kind of share projects, and just ultimately be able to connect as we all work to improve cardiovascular health outcomes. And then I think lastly, what I'll add is that CDPHE is also a member of the National Association of Chronic Disease Directors. So that organization is composed of about 59 state and territorial state chronic disease directors and their staff, who are really focused on advancing the health of the public by addressing primary and secondary prevention efforts and really focusing on the upstream kind of factors and root causes of chronic disease. So that network really is a unique opportunity and allows us different opportunities to engage and collaborate with states across the country. I think just to finish this off here, as our work evolves and we continue to engage with new partners across the state, we're always looking for new opportunities to collaborate with other partners and bring other partners into our work as we focus on strengthening those community clinical linkages and ultimately improve cardiovascular health outcomes throughout the state.
All right, thanks so much. I want to shift over into audience questions. We have a couple of them here, and they are not surprisingly about what you might call the situation.
Mm.
First question from Mary at Colorado Nurses Association. How will community health partnerships that we've described here be affected and respond to the funding cuts that we're anticipating? And if anybody wants to take that, go ahead. I think I could also done some work on federal policy, so I can chime in too when you're done.
I have some thoughts if you want to add in federal policy afterwards. So regardless of our current state, we launched this network thinking about sustainability from the very beginning. And why I'm bringing this up is that there's this reality that many of us have seen and therefore are bought into the impact of these linkages, right? But I mentioned the challenges involved, right? In capacity, time, and building them. So one way I would reflect back and answer to that question related to the current state is we are already sort of exploring ways to build on existing initiatives and requirements that many of our organizations are already tapped into. So for example, right, regardless of what's moving forward, what we know right now is a lot of our clinical organizations already have certain metrics, already have certain requirements to address chronic disease, to address health-related social needs, initiatives to build partnerships with other organizations. So it's really tapping into what's already built into the structure, what's already built into their processes, regardless, right, of perhaps unknown or predicted funding shifts and challenges, right, that we're seeing ahead. And then secondly, I would say thinking about the community-based organizations, this work truly wouldn't be possible without all of them. There's a lot of questions involved, right, in how we continue to fund direct services. And something that we've heard from them, though, right, is in order for them to keep doing the good work, right, they need people to enroll. And so I think for them, right, that's why they're still at the table, regardless of questions about current and future state. And in all of that, I know I don't have time to go into it, but we really are investing a good amount of time in an innovative sort of framework around value of investment to better come with specific data, right, of how these linkages improve health outcomes, both from the person's perspective, but also financial perspective, to be able to continue to drive forward this work and the conversation.
All right, and I would add this is on our minds every day, every hour at CHI, as I'm sure it is for just about everybody on the call. We are trying to figure out how to wrap our minds around everything that's coming out of Washington in the hopes that we can build some some graphics, some analysis to help everybody else get their minds around it. It's a huge problem. It's a problem that I don't think any of us have encountered in our lives. This perhaps loss of perhaps billions of dollars in federal funding. But it's still a problem that we can conceptualize and work piece by piece. And that's what we're trying to do here. I think in the next month or so, you'll see something out of CHI that starts with just kind of showing where precisely the vulnerabilities are to here in Colorado to cuts in federal funding. Unfortunately, Department of Health, Public Health and Environment is one of those where about a third of the funding thereabouts comes from the federal government. So we'll start with that, and then we'll kind of be asking around for everybody, what are some solutions to this? I think it's going to take a lot of creativity and a lot of drive and grit to work our way through this. But good news is here in Colorado, we've got a pretty good infrastructure already for full of people who are committed to it. Another question along these lines, and Kirsty, I'm going to toss it to you first because you'd already mentioned a little something about it. Deanna asks, how do we maintain trusted relationships with community partners when they're being affected by attacks on their members? And we are in a place where it suddenly feels dangerous to even say DEI or health equity. These community groups, some of them are risking a lot. Deanna says, feels like a time for healing and validation of the realities they're facing.
Thanks for the question. In the question, I already feel heavy, but I want to respond thoughtfully. I think my answer might seem too simplistic, but honestly, it's what's worked for us thus far since last November. It's honestly taking time to talk about what's going on. It's interesting just to open up the conversation and give our clinical and community partners a chance to say, hey, here's what's going on in our organization or our team today or this month, what's happening in yours. I can't believe, or I can believe because I've seen it, right? But it's incredible how just like engaging in shared dialogue can really make a difference during these really challenging times. And in that, right, I think that can happen virtually or in person. I mentioned the power of in-person connections earlier. I definitely think that is where we've seen most of these sort of like robust, in-depth conversations happen across these organizations, but certainly it's happening when we're meeting monthly with them online as well. So leaving space just to talk about current state, what we're trying to do about it, what we see ahead. And honestly, though, I think what we've done from the beginning that perhaps helps facilitate that trusted and open dialogue now is we took time already 2 years ago to leave a little bit of space during every single meeting to get to know each other as people. Right? Like, what's happening in your life? How are you doing? General opening sort of like exercises just to get to know each other as individual humans outside of the workplace. So again, I acknowledge it may seem overly simplistic, but I think just like that time and intention of creating space to get to know each other and be able to talk about this has really made a difference.
Yeah, the power of chit chat, it really is something, you know, building just building these tiny little mundane relationships. That it's amazing how much of the load that bears in our society. Um, a, a question here from Sarah Miller. On the RHCs. Sarah notes she was part of the initial conceptualization of this idea a while back. She says, "Yeah, I was there a while back, and I remember a lot of this as well when I started at CHI." Um, when they did this, they looked at the CSU Extension Service as a model. I know CSU Extension because they like write gardening fact sheets that help tell me what to plant and when. But CSU Extension does, they're everywhere in the state. They do a lot and they have sustainability solutions. Have we looked at all to them as a model?
That's a great question. Also, always an honor to have folks who are part of the original RHC developers, having folks in the room. So thank you for joining. I have not personally looked into the CSU extension model, but I am, familiar with extension models in general, and I think that's it's a really exciting opportunity. Actually, we're something we're working on right now is sort of a statewide alignment framework and sort of having a more standard but flexible, right? Because each region is unique and we want to maintain that uniqueness. But having some sort of framework for engaging with different state agencies. We're testing one with the project with the raise that Shelby was telling us about earlier, but that would be a really cool one to kind of explore coming up. And so I'd love to chat offline if you wanted to reach out and something that we can dig into or look into what might be next with that too. Yeah.
All right. I have a comment here that I want to just read verbatim. It is, and somebody wants to share anonymously. They say, as a federal employee covering Region 8 states, that includes Colorado, please know our hearts are with our state, local, and community partners. Our teams are decimated, and those of us remaining are trying to figure out where the dust is settling so we can continue the work we're able to do. This work will look and sound different, but know that federal partners who are advocating for the good work being done are still here and will hold the line as much as we can. In community, we will figure this out together. That, you know, chisel that in granite somewhere. That's just quite the testimony, and thank you to our anonymous federal partner in the audience, both for being here, for the work you're doing under conditions I can not even imagine. And your state and local partners are here with you too. I think we do have time for another question, and we don't have anything in the queue that I see, so I want to leave it on a little bit of a happier note. As you're doing this work day to day, what's something? What do you draw inspiration from that keeps you going in, again, times such as these? Who'd like to take that first?
I can jump in. Yeah, I think we've talked about quite a bit about this, right? They're uncertain times, but I think something that gives me inspiration and kind of keeps me going is just knowing that the work of community clinical linkages, being upstream and creating those connections, is inherently like that's the way to really make an impact at a large, like on a large scale, right? So making these connections, having these collaborations, really drawing on each other's strengths. Like this is the time to be doing that, and really leaning on each other, figuring out how we can support each other at this level, but you know, on all levels of the systems, because that's where that greatest impact is, upstream. So we're not having to pull folks out of the stream way down the line. So yeah, that's what gives me inspiration, is just knowing that this is so important and even more so right now. So
Yeah, I'll go ahead and take it. First, I just want to say I echo everything that's been shared so far and the sentiments that Elizabeth shared. For me personally, one thing that really inspires me and kind of keeps me rooted in this work is knowing that by creating these linkages, right, between healthcare systems and community-based partners, we can help to ensure that individuals, either who have a chronic disease or maybe at risk for a chronic disease, can get connected to and access the services that they need to be able to prevent and manage their chronic conditions.
For me, it's the people.
Mm.
It's the people who keep me going. I think it's a privilege that I can sit here with you this morning and talk about the work that we're doing. But truly, right, none of it would be possible without our community and our clinical partners involved in this network. So a huge shout out to them. You know who you are. Just yesterday, we had one of our monthly practice meetings, and I always look forward to seeing them, but I have to say, every time I leave those meetings, I'm still surprised how much more energized and hopeful I am, right? We talk about hard things, but it's their sort of like commitment and vision and energy to the work and the stories they share, right? About the community members, the patients or clients that at the end of the day, right, we're like seeking to serve, that continue to inspire me and keep me going. So there's no other way. We have to move forward, and we're doing it together. So thank you. You know who you all are. We really appreciate your partnership in this work.
All right, that's a great place to leave things. I want to, first of all, on behalf of Christy and Lauren, our guests from CDPAG, thanks so much for joining us today. The work's more important than ever, so let's get our communities linked, and being here today is a good step in that. I want to invite you to our next webinar next month, May 22nd, again at bright and early at 8 a.m. Speaking of linkages, we're going to be talking about work CHI has been doing for the past few years linking things that you wouldn't, that often exist separately in people's minds: climate change, health, and insurance. So we've been working with the State Division of Insurance on how these three topics are really all bound up together. And we'll be joined by a great panel, including Insurance Commissioner Mike Conway, Carol Walker from the Rocky Mountain Insurance Information Association, and State Senator Cleve Simpson from the San Luis Valley. So that is at, again, May 22nd, 8 a.m. There's the QR code on your screen right now. You can use that. If you miss it, fret not. We will be sending out a follow-up email to everybody who registered for this webinar, probably this afternoon. That will include a recording of everything from this morning and links you might be interested in. And of course, we will not be shy about sharing this link for next month's webinar. Thanks so much for joining us, for giving us your time, for the work you all do, and good luck out there.